Well, Brent, making more prescription drugs here in Connecticut is one of the recommendations from this bipartisan legislative task force. Another is holding the middleman accountable when negotiating those drug prices between the manufacturers and the insurance companies.
There's a bipartisan plan to bring down the cost of prescription drugs in Connecticut. State Senator Jeff Gordon, who's also a practicing doctor of 33 years, says he's seen the struggle up close.
More and more each year, I see more hardworking people and families and retirees not able to afford the cost of their drugs.
State Representative Jillian Gilchrist says she's heard from people in need of diabetes drugs and other life-saving medication who are finding it tougher and tougher to pay for pills.
We've heard from folks that expense of prescription drugs is causing people to take half their medication, to try and take their medication over the course of a week, even though they should be taking it daily. And this has dangerous impacts to those folks and their health.
Now, this task force of legislators is out with new recommendations to make the cost of prescription medicine easier on the wallet. State Senator Matt Lesser says it starts with upping the supply by producing locally or partnering with our neighbors to the north.
By bringing in low-cost Canadian drugs, we think we can disrupt the market and bring in affordable alternatives.
But another piece to the equation is regulation, specifically the pharmaceutical benefit managers who help determine prescription drug prices.
What we're trying to do is how do we create an incentive for everyone to lower prices? That would really make a difference, and that will help us make this whole system work a little bit better.
A recent investigation by the Federal Trade Commission showed these companies sometimes raise the cost of medicine by as much as 1,000%.
I understand companies make money, but when you see these huge profits that are not rolling down to help lower the costs, that's a problem.
Lawmakers say this system of profiting off customers' medical needs is not right and not sustainable, and they feel the only way to fix it is with more oversight.
So I'm not saying getting rid of the PBMs, but we really need to make certain that they're transparent, make certain it's clear who they're working for, but also making certain that they're not burdening the decision-making that goes on that leads to patients needing to get these drugs.
Two bills addressing this topic are up for consideration at the state capitol right now: House Bill 7192 and Senate Bill 11. We reached out to CBS Caremark, which is one of the biggest pharmaceutical benefit managers in the United States, for a reaction to this, and here's what a spokesperson said, quote, "Any state policy regulating the pharmaceutical supply chain should be evaluated through a simple test. Will this increase or decrease the cost of prescription drugs? Unfortunately, HB 7192 and SB 11 would only increase drug costs for the state of Connecticut, its employers and its unions, and its consumers, while serving as a handout to Big Pharma." In studio tonight, I'm Bridget Bureau, Fox 61. Brent.